Hello, everyone, and welcome to our December webinar. This is a monthly series that the Go Green Initiative and the National School Boards Association have been putting on since March. We are in a partnership that we thoroughly enjoy and appreciate with the National School Boards Association to promote energy efficient indoor air quality management with K through 12 schools throughout the country. And so starting in March, when we got an EPA grant for 5 years to do this work, we started a monthly webinar series. And this month, we are so excited. I'm wearing a pin that I want everybody to take a look at. Okay, that's a canary. That is an indication that I'm a member of our guests club. It's called the Air Club, and you can join too. And I know she'll tell you how to do that. But Dr. Georgia Lagoudas is with the Brown University Pandemic Center. She's a senior fellow there, and they have just come out with an amazing resource that she is going to be talking with you about. They're working on state policy as it pertains to indoor air quality. They have a whole section on schools. One of the things that I want to let everybody know is that because this is a Zoom webinar, we're not all going to be in the same chat. We're not going to see everybody's faces, but everybody can put their questions in to the Q&A section that you see on your toolbar, and we will get to those questions. I also want to let you know that because we know people sign up and then something happens and they can't make it to the webinar, we record all of these and we will share that recording with everyone who registered, and you can share it too. It's on our YouTube channel. And so we will get that out 24 hours after this live webinar. You'll be receiving an email with the link to the recording of this webinar. You'll get some links to some of our partners' resources, which I know Dr. Lagoudas will be mentioning as well. You'll get a link to the resource she's covering today and so much more. So without further ado, it is my distinct honor and privilege to introduce my good friend, Dr. Georgia Lagoudas. And Georgia, we'll have you take it away, and I'm just going to go on mute. But if we have questions and things like that, we'll go back and forth, but the show is yours.
Wonderful. Thank you so much, Jill, and delighted to be with you today and with the Go Green Initiative and all the members out there in the audience. So thrilled to be able to talk about clean indoor air and the opportunity for actions with schools, and share a little bit from my own perspective about the initiatives going on both at the state level, which I'll dive into today, as well as some of the work that I've been helping lead at the international level. And before sharing slides and diving into the presentation, maybe I can just share verbally some of what I think has been a lot of momentum over the past few months in particular. We were joking with some colleagues that September of this year felt like Indoor Air Quality Month, for not just the United States, but globally, because there were a number of events. And in that month, a number of organizations have put forward resources and activities, in addition to the publication of this state guide on indoor air quality. The Center for Green Schools has put forward materials. The International Well Building Institute hosted an event and a summit in DC. ASHRAE, which is the organization that brings together ventilation engineers, had an international convening. And we hosted an event at the United Nations that Jill was mentioning is related to Air Club, which I'll mention very briefly at the end, but at a high level, we brought together leaders to declare for the first time indoor air quality as a fundamental human right and recognize its importance to stand alongside other basic human rights like clean water. So it's been a good flurry of activities, and we're all staying busy. But Jill, if it sounds good, I'll go ahead and share slides and dive in. Um, So to dive in, this guide was developed with state leaders in mind. And in particular, by state leaders, I mean a few types of people that can be governors, that can be other executive branch leaders or officials, that could be leaders within state public health departments or state health departments, that could be legislators, and that can also be school leaders or education leaders across the state. And we were really excited to partner with the International Well Building Institute, the U.S. Green Building Council, Center for Green Schools, and the Environmental Law Institute to co-publish this document along with a number of other contributing authors. So lots of wonderful experts to help provide what is a synthesis for what state leaders could advance. And this builds off of the collaborative that I mentioned, which our first gathering was in partnership with Texas A&M University to outline the opportunities at the federal level for state action last year. And then this year we published this guide. This is the front cover, a guide for state leaders to improve indoor air quality. And the purpose that we've outlined is to help, as I outlined, state and local leaders improve indoor air quality with an evidence-based menu of options for policies and actions. So I hope this is something that folks can directly receive, hear the recommendations, and be able to take those directly into action. And we also would love for citizens and advocates to use this as well. Okay, so
Doc,
maybe to dive into, I'd love to take us into a little bit more about the state guide and please make note of questions or parts that you want to highlight and dive into and would love to have an open discussion at the end to get your input on where this can be useful or how what are some parts that you'd like to learn more about. So we, in the guide, outline three top line recommendations. One is around coordination. The second is how to accelerate specific indoor air quality improvements. And the third is about specific recommendations for high priority sectors like schools. And you'll see that the second column outlines who we call out as the entity in charge, or the entity capable of taking action. And some of these can go to different levels, whether it's the governor's office or state health departments or school district or state education departments. And the what I hope to present here today provides a holistic view that this is a big, complex problem, and there's not usually one person in charge, and so that makes this an uphill battle. And there are pieces of it that absolutely can be advanced. And I'll try to I'll save a few minutes at the end to share about I'm here in Providence today through part of my work is advancing school indoor air quality policies at the Rhode Island state level. And would love to just share what we are doing there and how this could potentially be a template for action in other states. So just as a background, I think we all are aligned behind this, but kind of my top lines for why indoor air quality matters is that we spend most of our time indoors. Indoor is 2 to 5 times more polluted than outdoor typically, and we have a lot to gain from this, whether it's through health, improved productivity, reduced absenteeism, resiliency more broadly. So it's a really important topic. And in our first section, this is about strengthening coordination and capacity. And I'll try to go through these briefly, just providing snapshots of this as content you can find directly in the guide, and save a little time for us to linger on the school section, since I believe that's most relevant to all of you. This one, I think, applies to any level of action. We find this at the federal level, state level, school board, and school district level of putting someone in charge or adding this to their responsibility. And here we outline for a governor's office what it would look like for state leadership to appoint an indoor air coordinator. And they could further establish something like an interagency coordinating body or an advisory council, which some entities have. And then throughout this guide, and I'm giving some examples here, and I'll share a few more, is we provide snapshots of other states and what some states or entities have done. So here are two examples on the left of California having developed an indoor air quality task force. And you'll see there's quite a long list of different departments and entities that have been involved, to say there's a lot of different stakeholders on this topic. And as well, Maine has an indoor air quality council that has existed for many years, so actually over 2 decades, and has continued to advance interdisciplinary discussion of advisors. I also want to importantly highlight that Johns Hopkins has published a Model Clean Indoor Air Act a few years ago in 2023 that also provides some model language for state legislatures. It's a pretty comprehensive model law, so it's not something that I would see success of immediately taking off the bookshelf and saying, let's pass it and go. But it is a great starting point to look at the components of who could do what and dive into some template legal language. So they actually have some legal template language around an advisory body at the state level. In addition to in this kind of coordination bucket, the state guide provides recommendations to state and local health departments to provide guidance. And this also will be re-upped in the school section around where are some guidance that there's a lot of power to have a state health department or a school board or school district specifically give guidance around indoor quality so someone can point to it. And so this state guide has a few resources of what we think are some credible and reputable guidelines and links, as well as what are some outreach strategies that folks could do. And I know Jill is very well versed in some great education outreach strategies. When might someone issue guidance? I think it's really important to have standalone guidance that is published that people can point to all year round. And there's also opportunities, in particular with schools, of elevating and uplifting that guidance at particular times of need. So wildfire smoke events is one example that I think many of us are familiar with, especially folks that are out west. This is a map of how we've seen wildfire smoke pollution increase over the past 10 years in the United States. There's also allergy season around back to school season, which is actually when a quarter of all childhood asthma hospital visits occur, which is in the months of September, which is just behind us, but is a good reminder. But also respiratory disease season with flu season and others. We give two case studies of Montana and California with their wildfire smoke toolkits and outreach guidance that could be templates to follow. We've also developed, as a subset of this guide that we have on the Pandemic Center website, a toolkit that is maybe a little less relevant for this audience because it's targeted towards state health officials, but a toolkit for putting out guidance. And so the idea is that we provide a three-step action of how to issue the guidance, what it should link to, and what action the public can take that can be pretty easy to digest for especially high-risk periods like wildfire smoke and disease surge. And then we provide some guidance templates. These are geared again towards state health departments, but some of this might be useful language that schools or school affiliated folks might want to take a look at. We also have some resources in the state guide about what numbers to point to. So we talk about there's broad guidance, and then you can zoom in to say what actual parameters related to indoor air quality should I aim for. As I'm speaking, I should pull out my I usually carry around with me an indoor air quality monitor, and this is one that has particulate matter, CO2. So it's actually really clean in the room I'm here. It's 0.2 PM 2.5, and I think less around 700 CO2. So we're doing pretty well. But in some ways, like what can these low-cost air quality monitors help be a tool in aiming for good indoor air quality? So the guide has some numbers if that's something you're interested in diving into, or pointing your local school board or leaders to as good starting points. So now moving from that first category to the second category of recommendations is about accelerating specific indoor air quality improvements and what are some of the policy and tools we have to do so. This is around building codes. This is around leading by example in the state buildings and implementation support. And again, these can be relevant to schools. If you think of it with a school framework, each of these has their own place within schools. So the first section, and in particular, some experts from International Well Building Institute were really helpful in outlining some of the building code components. We've outlined how states and jurisdictions can adopt the latest ventilation standards into their state and local building codes, and I think the same is and can be done for schools. In the second category of leading by example, as I outlined in my prior work at the federal level, we worked with the entity that owned and operated government buildings to advance indoor air quality. And so there's a way to start with the buildings that we own and that are public sector buildings. So we provide recommendations there. And then finally, what are opportunities? And we have in the state guide a few case studies of incentive programs and implementation support. So that means if someone wants to make a change, what should they do and who should they call to do so? And so there are some opportunities for financial incentives around tax incentives or uh, uh, accelerated building permits for people that want to upgrade their buildings and do those assessments. And then there are also some great examples of pilot programs. In particular, I think schools are an area that has been ripe for doing some pilot programs and pilot interventions, as well as homes. And so here we have a case study from Rhode Island where the Department of Health here in the state partnered with some local community public housing developments to install air quality monitors and air purifiers to both monitor indoor air quality and then make some interventions. And now, finally, zooming back out, I wanted to enter the school section of the state guide. And also, I'll just highlight that we have components on homes, long-term care facilities, and workplaces. Um, and here with schools, just such an opportunity for leadership. And in publishing this guide, the Center for Green Schools was absolutely a major a leader and contributor to this, given their expertise. And so they weren't able to join us today, but Hannah Carter, Richard Johnson, and others have been great voices in this. And so I encourage you to I'm happy to put you in touch with them, but just I recognize them as some of the leaders with engaging with schools. So in the school section, the collaborative put together 5 recommendations, which you'll see is some of it is similar to some of the earlier ones, but in particular, publishing guidance and educational materials. So what guidance and targets can schools aim for? Encouraging local indoor quality management programs that I'm sure you've all have heard about before, setting standards for schools construction and performance, enhancing transparency and accountability. And by transparency, some of that means numbers, like what are we talking about with indoor air quality, as well as who does what if there is a change needed. And then number 5, providing implementation support. So finding some technical experts and or pilot grant funding that can help with changes that are being made. That is probably the hardest one because it is hard to make money appear to help programs, and it is something to fight for and prioritize. And with this, I just will share, and I can share a little more in detail. Um,
Are you here, Michelle?
Sorry, 1 second. Yeah,
You're almost done, or?
sorry, Jill, 1 second. I'm just gonna ask this.
While we wait, just remember that if you have any questions, we will get to all of them at the end of George's presentation. You can put those questions in the Q&A section of your toolbar in Zoom. I know that we've had a few questions come in, and as we get more, just please feel free to go ahead and put those in the Q&A section, and we will ask Dr. Lagoudas at the end of her presentation. So that's an opportunity open for all.
And Jill, sorry, I am just
No,
unfortunately going to need to move rooms for 1 second. So
no
I will
worries.
take 1 minute and then join. Thank you.
No worries at all. And in fact, while Dr. Lagoudas does that, I'm going to share my screen real quick. I want to show you all um, an opportunity that I mentioned earlier when we first got started, and that is our policy database for local school board members. So one of the things that we have been doing since we were awarded this EPA grant for 5 years to work on improving indoor air quality is we've been working with other grantees like the American Lung Association, like the Center for Green Schools that Dr. Lagoudas just mentioned. And so in order to create a 50-state policy database, we worked closely with the American Lung Association and Center for Green Schools to develop state-by-state guidance. Any state that you click on in this map will take you to a policy template that is based upon your state legislation that pertains to indoor air quality in schools. Now, I will say that the research behind all of the state regulations came from the American Lung Association. So we are very grateful to them for all the research that they put into that. And you'll see that reflected if you click on your state to find your policy template. So one of the things that we did, and I will share this in the email tomorrow that you get after we have this recorded webinar available for everyone. I'll also share a link to the American Lung Association's brand new resource that has all of this data very easy for you to see. It's an incredible resource of state by state regulations that pertain to indoor air quality for schools. But let's just click on one state real quick. You'll see this is the California template. Many of the templates look very similar, but you'll see when you scroll down where the California specific regulations are cited. We have everything from education code to labor code. And we also worked very closely with the National School Boards Association on this. Their state affiliate also helped us, and their teams that write policy also helped to develop many of these policy templates. So this is something that for local public policymakers will give you a leg up in starting your policy language. So I'm going to stop sharing and go back to Dr. Lagoudas, and the floor is yours, ma'am.
Thank you. Sorry for that. I will go back to sharing if that sounds good. Okay. Tell me if that works for your screen. Okay, perfect. Sorry, at a university, and we're doing a little room shuffling. But thanks for sharing a little bit about your tool, Jill. We were just, I think, wrapping up this section of some of the components for actions in schools. And again, recommend all of you to take a look at the guide. I didn't want to go into deep detail, but I was just outlining how in this fifth one around implementation support with funding, it is easier said than done. In particular, I think some of these earlier ones can be done with less resources, but obviously even providing transparency with like an air quality monitor to the problem is great, but then if you find problems, what should be done? And so that's something that we're actively thinking about in Rhode Island. What are ways to provide transparency to the problem, but also have an avenue for actions to be changed? We have highlighted, as I mentioned, throughout this guide and in this section, a few case studies. I wanted to share, there's one example from Minnesota where they've published a guidance for indoor air quality that's targeted towards school administrators. And they have an IQ management plan package that has all sorts of models. And I think a number of states have types of resources like this. So just one model that could be looked at. And a lot of this leans on, I think, the EPA tools for schools and the checklists that have been provided there, which is a really important foundation. There's also the National Center for School Infrastructure that Jill has mentioned and talked about, has a great resource hub, and they've been a partner in this and also have examples there. And then third, as mentioned, the U.S. Center for Green Schools has a whole series of IQ fact sheets for schools in particular that are excellent resources. And we had talked with Jill before this webinar about sharing some of the additional resources. They have a newer advocacy toolkit out that is a really, really helpful tool as an advocate. I will go back and just pause on schools because I think then I continue to the other sections to share a little bit about how we're reflecting on this work in Rhode Island or some lessons learned that has been through my experience with Rhode Island, other states, and then also with the EPA at the national level, that often we can identify areas where there is need, that there is a problem with this school, or there are a set of problems with indoor air quality because of people's own lived experiences or because of the age of the building or some other triggers. But there's not always a framework for action, which is what do we do next or who do we call? So we just hosted a convening yesterday evening at Brown University with state legislators and community members and teachers. And one of the state representatives shared her own experience of being a school teacher And during that time period, for 7 years, she was in a school with poor indoor air quality, developed pneumonia annually as a result of that. There was evidence of mold, and she tried to call and identify folks to come in and address the problem, but wasn't successful. And so now she's sitting on the seat of a legislator trying to find what is an avenue to make change. Um, all that to be said, I think there's a lot to learn from different school models and state models of who's doing what, and don't feel like you need to reinvent the wheel. That is our hope with the state guide, is that there's some case studies here, and it can be the state collaborative can be a resource if people have questions. But yeah, I just wanted to outline this piece of the framework for action is sometimes hard. And I think, Jill, you'll probably have some, and maybe we can discuss a little bit in the Q&A about what are those frameworks for action, and who can take the first step. And the piece that I'll leave with is, I think, number one, of publishing guidance is a really good and important step, because it does two things. It adds this to the priority list of decision makers at the school. If they're forced to say, we not forced, but they're prompted to say, let's put out guidance. What is that guidance, and what should we say, and where do we put it? It prompts this to be on their agenda. And I think number two, it then sets a very rough goalpost of what to aim for. What does it mean? What is good air quality? And suddenly, how do we start developing tools to measure it? So this might seem like a long and scary list of all these things that should be done. But I back up by saying, I think especially point number one, as well as point number two, are really good low resource lifts to begin the conversation. The piece I want to close about with schools as it relates to the guide is that we also have published action plans that accompany this longer state guide. These action plans are each 2 pages. And so we have one action plan specifically for schools that summarizes what the state guide has. And it summarizes the top 3 recommendations from the state guide, which is develop a management plan, conduct regular building assessments, with an example of Connecticut, and then number 3, publish guidance. And this is just kind of a nice, short, sweet, if you don't have time or capacity to read through a longer document, we'll make sure that those links go out to all of you. And this can be just a great, great talking point and starting point for a conversation with school leaders. And then briefly, just to show that we have additional sections about housing and what are opportunities to improve air quality in public housing. Thank you for the National Center for Healthy Housing, was a collaborator in this. And then we have the final sections about long-term care facilities, including elder care, opportunities for action, as well as workplaces where state labor departments can actually be a leader. And there are some examples from Maine and New Jersey on what they're taking steps to do. So with that is the summary of the state guide. And I think I have just some final slides to kind of zoom back out. One is about Rhode Island. So here are 2 bills that were introduced this past legislative cycle to advance indoor air quality in schools specifically. And there's a House bill on the left and a Senate bill on the right. I was involved in this process and helping advise the bill language. The Senate bill passed unanimously. The House bill didn't get out of committee, but we are revamping efforts for this next year. And in doing so, we've engaged local school district members here at Providence, statewide education leaders, both teachers and parents, and some student groups. We've also engaged the public health advocates like American Lung Association and the Asthma and Allergy Foundation, as well as the Workers Association, so like ventilation and HVAC workers, and researchers. And so we have created a team of, kind of a loose coalition of about 20 different organizations and voices, and are looking to promote next steps with potential action. And I share this as if any of this can be helpful in the work that any of you are doing or would like to see as models for ways you can jumpstart action in your, whether it's city or locality, I'm very much happy to be a resource. We've had some good actions across states. I just give some good news about a quarter of states have advanced some form of legislation in the past 5 years. And we have a database here. I'm happy to share the link if folks are interested to see what are examples of those bill texts. And this database also lives on our partner's website, the Environmental Law Institute, that has a lot of great resources additionally for state indoor air quality. So I'll make sure to share this link with Jill so that all of you have access to those resources which live on the Clean Indoor Initiative at the Brown Pandemic Center. I think I have one last slide here, Jill, which is about, I mentioned this at the very top, and Jill mentioned the pins we're each both wearing around Air Club. We were so thrilled to be able to pull together an international convening. 25 different countries joined, over 300 people, for the first ever United Nations side event on healthy indoor air. And we have a website, airclub.org, that you can take a look at photos, recording of the event, as well as a pledge that was launched, which is this on the bottom right, the Global Pledge for Healthy Indoor Air. And we'd love to invite any of you to join and be a part of this pledge. This pledge is for organizations. So if you, with your organization, would like to join, we have a number. I think we have about 250 signatories of the Global Pledge, including entities like Jill Wright Go Green Initiative, I think, is a signatory. Brown University Pandemic Center is a signatory, and other educational institutions. You can sign on as an organization and then also as an individual. If you'd like to join Air Club, go to airclub.org and you can sign up and be part of that. We're hoping to create a global community to learn from each other and advance efforts in the space. And I think with that, I'll say thank you. I'll leave my name and email up here and just say thank you to many collaborators across Brown University and many other organizations that have been such partners in this effort.
Thank you so much, Dr. Lagoudas. We do have one question at the moment, and if you all have other questions, please fill up that Q&A tab in your toolbar. Somebody wanted to know what type of air quality monitor you were using when you held it up and said, "We're not doing too bad in here. It's pretty clean."
Yes, I was holding up one that I carry around and throw in my backpack or purse. This is a TemTop device, which is a type of low cost, not the most accurate, but it is less than $150, and it's portable. The battery, there's an e-ink screen, so the battery lasts a long time. I think there's a number of other air quality monitor devices that do the job too, but this is one that I like to use, and it's pretty easy.
Thank you for that. I'm going to ask you a question, if you don't mind, while we've got you. A lot of our local school board members that we're working with through the National School Boards Association know their state legislators well. They advocate for any number of things, not the least of which is funding from the state always. But many of their state legislators are neighbors, friends, people they've known for years, people they meet with on a routine basis. What recommendations do you have for some of our local school district leaders who might be able to take this guide and take it to their state legislators? Can you give them some language to help prompt them to take a look and dive into state regulation around IAQ?
Right. Yeah, that's a great question. And maybe there's two parts of that that come to mind, Jill, both like what is language that can be a starting point to introduce the topic with state legislators, and then what could be language to propose action around, if there needs to be state legislative action or other kinds of policy action. The state guide has some, and I think other resources have some great language on background as well. So the state guide, the introduction has some simple like why indoor quality matters and what we're talking about. So you're welcome to pull from that. And those 2-page action plans have like really short summaries of why this matters. So that can be a tool that just pulling from those starting point or introductory comments can be a way to begin a conversation with the legislator. I can tell you just like verbally some things I like to share is that we have ventilation standards in buildings, but the way we have developed them in the United States is that the numbers that we have in there are based off of odor and smell, not health. So the ventilation standards we require in most buildings is for the number at which 80% of people don't complain about smell. We do not have health-based standards in buildings. And we have a number of issues that are of prime concern to children in environments where we're forcing them to be inside of a building for 8 hours a day, days on end. And we have some simple ways to measure if the air quality can be good or bad. Anyway, so that is one starting point that I might share, which is we should have health-based standards in buildings and we don't. And you can take your own angle. And maybe for the second part, Jill, that I'll add to that, which is what should states do about it, or what should legislators do about it? And so I spent some time working with some advocacy organizations like the American Lung Association and the Asthma and Allergy Foundation of America. I mentioned the American Lung Association because they're a very large organization and they have boots on the ground at most states across the United States, or like some people that are, a few regional states. And so we work with a regional partner here, and he's been tremendously helpful in that he's been able to connect us with legislators that care about this topic. And so we've actually found some legislative champions that either were school teachers themselves, or they care about public health, or they have some medical background. And so with their help, we were able to find a group of about 4 legislators, 2 representatives, 2 senators, to have that conversation with. And then we started with some proposed bill draft text, like what could be a starting point of bill draft text. And I'm happy to share the link for the Rhode Island state legislative bills that I showed briefly in the slides. And that can be a good starting point. Along with, I'll share the link to that database that you can go see those 13 or so other states that have passed text.
That's terrific. We have 3 more questions. One is, could you speak in reference to ASHRAE 241?
Okay, speak in reference to ASHRAE 241. What is it? What does it do? How can it be used? I can take my best guess at what that person was intending. A little bit about what is ASHRAE 241. I don't know if you guys have talked about it on webinars before. Jill? No, okay. So I won't presume any background knowledge. ASHRAE, it's kind of a nerdy, wonky thing to bring up. So ASHRAE is the American Association for Heating, Refrigeration, and Air Conditioning Engineers. So it's a team of ventilation and engineering experts that on a volunteer basis come together and develop standards for, among other things, building ventilation in the United States generally. And it's also adopted in some global settings. And those codes are then picked up, those proposed standards are picked up and adopted into state and local building codes. And they set the numbers at which your HVAC system runs. They also set numbers like energy efficiency standards or heating requirements or water quality requirements. And as I mentioned, the building ventilation standards we have historically have been based off of odor. And so they set some numbers that seem appropriate per occupancy of a room, like a room that typically has many people, dozens of people is going to look different than a room like a solo cubicle or office room. But those numbers have been typically based off of odor and comfort of building occupants. And in 2023, we engaged with ASHRAE during the pandemic to accelerate the introduction of a new standard that is based off of health. And so in 2023, ASHRAE published this new standard, ASHRAE 241, that they title Control of Infectious Aerosols. Basically, it's a standard for the first time that takes into account how do we have better ventilation to reduce health impacts and protect building occupants. And so a multidisciplinary team of experts came together, including public health professionals, that said, how do we set the level of air cleaning to protect people and try to help ensure that they're not getting sick? And so that's what ASHRAE 241 does at a high level, is it sets higher levels of building ventilation so that we can reduce sickness and buildings actually promote healthy environments.
Thank you, Dr. Lagoudas. Another question that was asked, should we install a monitor in every classroom or just the hallways or both?
Great question. It is a question in some ways of resources, of what resources and capacity do you have? The nice thing that's different between outdoor air and indoor air. For outdoor air, it's generally well mixed. So you might have one outdoor air quality monitor that could sit outside of a school building and generally tells you about that space. The tough thing is that indoors, every room could look different. So it could be that one room, the ventilation that feeds into that room somehow got blocked by someone's old backpack that got sucked up into the hood or something. And then that one room doesn't receive good air quality. So the short answer is ideally, we would have air quality monitors in most, if not every room of a building to know that each room is safe. I recognize that that is a high resource lift. And so there's an in-between of having a set of air quality monitors that could be distributed among the school, that could be in some school classrooms and in some hallways, as well as regular spot checks of air quality in all classrooms. So I think a really strong recommendation is on some regular basis, at least once a year, say, there should be some checking of changing filters in the HVAC system. Also, there should be some assessment of air quality in every room. So it's a framework to follow. There's a good model and there's a better model, but really these tools are something that turns the invisible into something visible. Like you can't manage what you can't measure.
Thank you for that. We've got one more question. Is the Clean Indoor Air Collaborative open to adding more organizations that are focused on public health and clean indoor air? And if so, how would such an org join this collaborative?
Yes, we would welcome other organizations to be a part. Part of us, as I mentioned, we're more of an informal group, so we don't have a website, but we have a monthly team meeting that we welcome folks to join in and listen and participate if they're interested. So I think if you're interested, please email me, and Jill, feel free to share my email with participants, and I'll connect you with a group, and very happy to add you to the list.
And it's wonderful. I mean, these meetings are well run by Dr. Lagoudas, and just jam-packed with amazing information. If you have a question and you haven't had a chance to ask it yet, please do put your question in the Q&A. We have a few moments left. I have another question for you, Dr. Lagoudas. Why do you think every school district in America hasn't already addressed this? I mean, we've had tools for schools for a long time. What are some of the barriers and challenges that we all need to be working on in order to enable schools to do this and do this properly?
Yeah, such a good question, Jill. And I think it's the question that we all, I think about and face in some ways every day, for those working in the field. I will start by sharing an anecdote, which was my wake-up call to this, that it's like it seems so obvious. Why don't we have cleaner air in spaces that we spend 90% of our time inside, especially in public spaces where you don't have a choice. And I was kind of awoken to this with the COVID pandemic and saying, how do we help schools have cleaner air to not only make it, healthier environment for students, but also safer due to COVID? And there were a lot of government funds that went out to support schools in purchasing short-term actions to improve indoor air quality. And so a lot of that looked like, some of it was used for other forms of personal protection, but some of it was around purchasing air quality monitors. And so I give this as a really small anecdote to say money was spent on purchasing air quality monitors, air quality portable air cleaners. And I think a large majority of those are now going unused. And there's a few reasons. Number one, the technology isn't quite there yet to have, and by technology, I mostly mean user design, to something that isn't dependent on someone like a teacher to come inside the classroom, push a button to turn it on. Maybe you trip over the cord because it's kind of loosely next to the wall. It's taking up floor space that you end up putting textbooks on top because you don't have another place to put it. It uses up a plug that you don't have extra plugs for. It's also not fleet coordinated. So it's not like something one facility manager for the whole building can coordinate. So there's one bucket around technology improvement around user design. We have the technology, we have the filters, we have fans, and we can put them in a box. Like that is easy. But what we deployed quickly during COVID is an example of what's really user-centric that's focused on at home. At home, you might want to turn it on and turn it off, and I want to have it on high and on low. But in a school setting, it should be set and forget, and it should be automated for the environment. So that's one component through this anecdote. And then the second was that there was no one institutionally put in charge with the responsibility to maintain these regularly. Ideally, you upgrade the building. And so you don't have to think about it. You have higher quality HVAC systems that provide mechanical ventilation. You're flowing at least 5 air changes per hour in these rooms, and you're maintaining temperature, humidity, and CO2. That's ideally. Most schools, I think, I mean, so I'll say, for New England area and like Rhode Island, in Rhode Island, about half of schools don't have mechanical ventilation. So that's a lot of schools. You have to think about what you can do right now rather than wait in a decade or two or three when they might be renovated or rebuilt. So in that kind of second bucket of you have to have someone in charge and someone that owns that responsibility. And I don't think those are two major lacking measures that you've, I'm sure, faced, Jill, as well through your efforts. And this second bucket, it's multifaceted. There's a lot to unpack there, right? Of like, what is the role of a state legislator? What is the role of a school leader? What is the role of an individual school board? But ultimately, we need to have the foundation, which consists of two things. We need to have foundational technology, and we need to have foundational demand that clean indoor air is a human right, and it is unacceptable to have poor air quality. And I don't think we've quite been able to arrive at that as a society. And then on top of that, we layer the policies and procedures to put someone in charge and to make sure this falls into your operations and maintenance requirements. So long-winded answer, but I think there's more for improvement for us to keep working on.
There absolutely is. And I think that this EPA grant that I know that we and the Center for Green Schools and the American Lung Association, we're so grateful to have this grant because it's allowing us to get out into school districts, get boots on the ground, and ensure that we are listening as much as we are delivering resources to hear their answer to that. Why hasn't this happened already? What are your challenges? What are your barriers? And then advocate for the resources needed to overcome those barriers. And I want to do a little show and tell real quick because I always love a little show and tell. Who doesn't love show and tell? On our website, gogreeninitiative.org, we have some resources that we are building out monthly throughout the course of this grant. More and more of this will come. You can go to our indoor air quality page and see, all kinds of resources. But I want to highlight this one right here, our courses. We hired somebody with a master's in design, instructional design from USC, Go Trojans, to develop online courses in conjunction with a team of former senior school district administrators. So these courses are aimed at folks in facilities, folks in the C-suite, if you will, of school districts to help them design and develop indoor air quality management plans. And we have been working in conjunction with the Center for Green Schools and their energy efficient indoor air quality management guide and EPA's tools for schools as sort of the backbone of our courses. And we walk you through the groundwork. Where do you start? If you have no experience whatsoever, What are the steps that you need to take one by one to develop your school district's plan? And we have much more coming. You'll see our coming soon page. But these courses, when you get on them and you are a senior school district administrator or school board member, you will recognize right away, whoever designed this knows us. Your peers have designed these courses for your busy life, for all of the things that you are dealing with besides indoor air quality in your school district. And you're going to feel very comfortable when you take a look at these courses. They're free, available to anyone, anywhere. And so I really encourage you to get out on these courses. If you are just starting this amazing journey, get out on gogreeninitiative.org and click on our IAQ courses page for more details. Well, that just about does it for us. I want to thank Dr. Lagoudas. I want to thank the Brown University Pandemic Center and all the great work that you're doing. As I mentioned, everybody's going to receive an email tomorrow with a link to Dr. Lagoudas' slides, her email address, by the way, in case you want to join Air Club or have other questions, and a number of other helpful links to resources to help you get moving on this. We have a simple belief at the Go Green Initiative. We believe that children should not become sick because they have to go to school, that their school building or their school environment shouldn't adversely impact their health. And because we believe that, we work hard to help school districts address various contaminants, various hazards on school property so that schools are a healthy place for children to learn. And so we thank you for joining us for this monthly webinar. We'll be here next month with another one. We're going to be talking about a grant opportunity, $45,000 grant opportunity for school districts across America, and in-person, boots on the ground technical assistance for your school district. That'll be coming up second week of January. More information out in our social media. So thank you all for joining us. Any parting words that you'd like to leave with our audience, Dr. Lagoudas?
I do want to leave with some optimism
All
that
right.
this is an important topic. There's a lot of good work to be done. So, I'm excited to keep working on this. I'm coming enthused off of the heels of a great convening with Rhode Island state legislators and education leaders. So I think there's appetite for change, and so glad to be able to be in this community of sharing resources together with you, Jill.
Well, thank you so much. And we're so pleased and honored that you're part of what we're trying to do as well. Teamwork makes the dream work, am I right? So the more heads we put together, we can solve this problem. This isn't too big for us. We can do this. So thank you all for joining us, and you'll hear from us tomorrow via email.
Thanks.